Hello friends, what is cement retained full mouth dental implants and how long does it take to receive full mouth dental implants for any patients? In this video, I, Dr. Mayur Khernar from Precision Dental World, I am going to explain in detail about cement retained full mouth dental implant and the timeline to receive it. In last video, you must have seen screw retained full mouth dental implant solution. If you have not seen that video, you can press the I button on the upper right corner and you can view that video. So, what is cement retained? Cement retained means the teeth which is given on the implants are fixed to the implants with the help of cements, and these are nothing but resin cement. So let me explain you in details. For example, I'm taking this case for you for a better explanation. Now, this was a situation of the patient, that was a profile of the patient, and intraorally you can see only few teeth were present. When we see his x-ray, we came to know that the bone in the upper jaw was quite compromised, the lower bone was quite okay, but still it was not so great. In fact, the upper jaw right hand side, the sinus was heavily expanded. So we decided to see his CBCT scans, and in the CBCT scans we found the same. The bone was very thin and very minimum. He wanted to avoid all kind of sinus lift procedures. He didn't want to wait for long period of time. So what left out with us was a immediate loading protocol. That was a scan in the lower jaw. So these scans are nothing but a third dimension of your dental OPG. We will be coming soon with a video on dental OPG where it will be published on the above right corner of the screen with an I button. So what is exactly the third dimension? Let me explain you with the diagrammatic representation. In this image, you can see a two dimension of a upper and lower jaw. What we cannot see is the third dimension. Third dimension is nothing but the width of the jawbone. Now this blue line is representing two possibilities. Either the patient must be having a very good bone width, or a patient must be having a very thin bone width. So if it is a good bone width, no problem, patient can easily receive a good normal two-piece dental implants. It is wider enough. But the problem happens when the bone is very thin. The two-piece implants or wider diameter implants that cannot be placed. It leads to the exposure of the implants at the corner, and that's where the bacteria attack, and it causes your peri-implantitis or implant peri-infection. So in that situation, what many doctors do, they do bone grafting. Either they take a jawbone from here, or they take a jawbone from inner side of the jawbone, and then they transplant over here. So this is nothing but an augmented bone. But 90% of the chances there is a possibility some or other problem arises when it is an artificially augmented bone, and this is not so great successful. The best success rate are those when the implants are placed into the patient's own natural bone. So that's why instead of modifying the bone design, the design has been modified. The design of an implant has been modified to place into the suitable jawbone. So this is how a single piece implants work really excellent well when the jawbone thickness is very thin. So this is a protocol in single piece implants. Implants are placed in greater number of, and they are slightly bended at the neck, and these are all cement retained. They don't have an option of screw retained, what you saw in the last video. These are two different designs of immediate loading single piece implants. One is a regular, which is called bicortical implants, and the second is a compressive implants. So both of them have a narrow neck, because of which the implant can be placed in the thin bone. So what is the advantage and disadvantage? So advantage is single piece implant can be placed in a less bone cases. It can be placed without opening the flap. Most importantly, some find it advantageous that more number of implants are placed. Some find it less advantageous because sometimes you can place with a less number of implants as well. And some find it doesn't require any screws. There is no problem of screw loosening. So that is one type of advantage for someone. But in disadvantages, the most biggest disadvantage of this kind of a technique is the retrievability of teeth process. You cannot take the teeth out whenever it is desired. Either you have to just cut it out and you have to take it, or you have to loosen the cement and you have to take it. Sometimes intraoral corrections as required. Means if there is something problem is happening to any of your teeth part, you cannot send it to the laboratory. What you can do into the screw retained solution. Here you have to repair it intraorally. So that is the only disadvantages, but it is excellent solution when it is very resorb bone cases, and it is worth going for single piece implants in the resorb bone cases. Yeah, so let me explain you about the implant placement. In the same case, can you see the implants are placed into the upper and lower jaw. It is flapless, that is minimally invasive, no flaps is taken, and that is a day 1 healing. In this, a single piece bicortical, which you can see above me, is been placed, and you can also see the x-ray. That is a face bone transfer and jawbone relationship. Also your jaw relationship means how you close your jaw. So we record that position with the help of this step, and after that impressions are taken. It has been sent to the lab. The laboratory pour the cast. They make your model. On this model they make an articulator. It is just nothing but similar to your jawbone. It opens and closes like your jawbone, like how you open and close. So it mimics that particular thing, and over that they fabricate something called wax pattern, and followed by they fabricate the skeleton of your teeth, and nothing but it is called metal trowel. So you see, that is a day 1 and day 2 healing, and usually on day 2 healing we call to the patient, we check the healing totally. After that we have to do some preparations of your implants abutment, that is the head of the implants, and on that, over that, a metal framework is seated. This metal framework is nothing but a skeleton of your teeth. On this metal framework, a layered ceramic or a porcelain will be attached, and in future that will be your teeth. So that is a day 2 framework. This is called first trial. Down. This goes into the lab. Now in the lab the ceramic is added. If you can see, that is nothing but a ceramic is added. This is the second step. Is something, sometime we require a fabrication of deprogrammer. Now deprogram is something when a patient is very finding difficult to give you a jaw relationship, like patient is not giving a proper bite, maybe because he or she must be chewing so long on a wrong side or on a front side, wherever teeth were present before. So in that situation you may need sometime deprogrammer. So we use that deprogrammer to relax your jawbone muscles, and then we record your bite. So that may take an additional appointment. So this is BIS trial. Day 3 we usually do a BIS trial. BIS trial is nothing but unpolished ceramic teeth. We do the BIS trial, we do the adjustment, we make sure your teeth are touching both on right and left hand side back teeth at same time, so that this creates an equilibrium of forces coming on the implants. Now after this BIS trial, it goes again back into the laboratory completely finishing and does the finishing and the polishing of the prosthesis. It becomes now very shiny and smooth, and then we use this resin cement. It is an expensive and the most toughest cement in dentistry. This is a very strong cement, and it is costing way as compared to the rate of the gold. After this, on day 4 or sometime day 5, we fix the prosthesis with the help of the resin cement. Now this is the case in front and right and left hand side of the same patient, so you can appreciate that. That is an x-ray of the patient after giving the teeth. So you can appreciate almost in the upper jaw, only in the front region there is a bone, and the back region there is a bone. In between there is total sinus. So even if with that we have avoided that, and in this situation we have given even the lower the single piece. But ideally, if the bone is good enough, we can still give a retrievable option, and we can make a combination of upper cement retained and lower retrievable. That is the final happy patient on day 5, and his quality of life is improved. So with this, I hope you got a clear idea about what is cement retained implant solution and what is screw retained implant solution. If you like this video, do not forget to subscribe our channel Dr. Mayur Khenar. On this video, you will find lot of videos of high number of success stories and a lot of full mouth implant cases, which will be really helpful for all of you. Well, you can also see what full mouth implant patient says after the treatment in this above tab. You can also see the most important video related to screw retained implant solution in this tab next to me. Till then, enjoy and keep watching our videos and get more and more educated. For the time, see you again. Jai Hind, Jai Bharat. Thank you so much.